Okay, we're talking about spine injuries. Um, Compression injuries can result from a fall. Forces that compress the patient's vertebrae body can cause herniation of discs. Do you have any fun stories about herniated discs?
Well, it reminds me of when we had a patient. She was in a store walking through, and somebody was doing some work on the ceiling, and unfortunately, it fell down right over the top of her and caused axial load injury. Axial load is when there's pressure pointing straight down on top of your head, compressing the spine. That causes damage to disc. Can cause damage to the vertebrae. And in her case, she had multiple vertebrae and multiple discs involved. All that can be very dangerous because with a compression fracture of a vertebrae, you have retropulsion or pushing back of the bony material into the central canal neural tube up against the spinal cord. And of course, if that's not dealt with quickly, that could lead to paralysis. She luckily got immediate care, was taken to the hospital, and was decompressed surgically. Long recovery, but it turned out okay.
Also, motor vehicle crashes can overextend the spine. So when you're wearing your seatbelt and it goes across and you hit, you lean forward, and that can overextend your spine.
Right. That could be part of the rotation flexion injury as well as the seatbelt, depending on your passenger or driver, as you not just going forward up against your steering wheel, you now have a locked seatbelt that's causing you to rotate. Now you're going to be damaging possibly some muscles in your that are support structures for your spine, but also then with a kind of an obtuse pressure on the disc, you're looking at a lateral disc extrusion going right onto the nerve root, which can also lead to paralysis.
Um, when the spine is pulled along its length, it's called hyperextension, and it can cause fracture. Do you know, like back in like the medieval days when they would like draw and quarter people?
It puts you on the rack.
Yeah, like that's hyperextension.
that would be that would be an extension. Hyperextension a lot of times is also flexing back, which, excuse me, sorry, the on some of the racks back in those days they were actually put at an angle. They wouldn't pull straight, and they would slowly pull you apart that way. But the other injuries, say sports injuries, sometimes you get hit in football. What happens? They get forced backwards while someone's pinning their legs down. You'll see that with wrestlers too, with certain maneuvers. They do a hyperextension injury. One of the issues with that is on the back part of the spine, the posterior aspects. You have these are called facet joints. You see these here? They're held together actually by some very small bones in there. So the pedicle is basically, and that obviously isn't near as big as a vertebral body and can't handle that stress. So if you force enough pressure back, you can actually crack that. Problem is when that cracks, you now have an unstable spine. We call it listhesis, and that is going to cause slipping, putting pressure on the spinal cord, which could very easily require immediate fusion surgery.
Okay. Well, we will be back to actually talk about medical emergency care of the spinal injuries next time.